We have with us Dr. Aswani Yadav, consultant cardiologist, Metro Hospital and Heart Institute, Haryana. Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Myself, Dr. Aswani Yadav, and I'm working as a consultant cardiologist in Metro Hospital, Rewari, Haryana. Yes, there are many cases which shows that increased incidence of both hypertension and heart attack in younger populations, particularly less than 40 years of age. And the common causes of all these as routine day-to-day stress life, physical inactivity, and many type of stress that may be work related, home related, financial, and nuclear family. And commonly nowadays addiction is also common, so these also contribute to the heart disease at a younger age, like smoking and addiction to various drugs like cocaine use, marijuana, particularly in young populations, and association of this comorbidity like diabetes, hypertension, obesity, high cholesterol, because these are nowadays 2 to 4 times more likely common in younger age group patients. And the scenario after COVID-19 also changes, that leads to the more coronary atherosclerotic disease, and particularly the one type of MI patients heart attack, that is coronary artery dissection, what is particularly common in young male patients particularly. So, and also the family history, so that might predisposes to the incidence of heart disease and hypertension in a younger age, less than 40 years nowadays. So there is a change in the scenario compared to the early decades.
Doctor, what is the relevance of heart rate in hypertension?
Myself, Dr. Aswani Yadav, and I'm working as a consultant cardiologist in Metro Hospital, Rewari, Haryana. Yes, we know that common heart rate is around 60 to 100 beats per minute. Anything below and above is abnormal. And the most dangerous thing is the heart rate above 100, that is tachycardia. Because we know there is a hypertension, it is a common clinical problem and a major risk factor for the cardiovascular disease as well as stroke. And this increase in the heart rate, it causes increase in blood pressure and increased risk of hypertensive complications like brain hemorrhage, heart attacks. And among hypertensive, if there is a further increase in heart rate, it contributes to the increased cardiovascular risk. And in various studies, it has been found that heart rate is an independent risk predictor for adverse cardiovascular as well as the general mortality risk factor. And the factors might contribute which increasing heart rate is maybe stress, increased intake of coffee, emotions, and migraine headache, excessive alcohol consumption, smoking. These are all dietary and lifestyle changes contribute to the increased heart rate, and it has relevance to the hypertension as well as the cardiovascular disease.
What precautions should a patient take along with medicines?
Myself, Dr. Aswani Yadav, and I'm working as a consultant cardiologist in Metro Hospital, Rewari, Haryana. One has the disease like hypertension, diabetes, other comorbidity like dyslipidemia, obesity, hypothyroidism, hyperthyroidism, these disease. So one, besides the medications, the other precautions that should be kept in mind is that the diet lifestyle changes. That includes among daily exercise at least 30 minutes per day and 5 days in a week. So that is the first is the exercise. Second is avoidance of excessive alcohol and smoking. Third, keep the diet balanced, like consumption of fruits, vegetables, and consumption of less sugar. And there is a weight reduction, and that should be the priority of around average body weight BMI around 20 to 23 maintenance.
Public awareness initiative by Glenmark Pharmaceuticals.